Here we are at Pro Chiropractic, and today we're with Jill, and we're going to be doing a gait scan. The Orthotic Group, orthotic manufacturer out of Canada, created this gait scan. What it has is 4,000 little sensors in it that measure 300 times a second, and we're going to have Jill first stand on it. Go ahead, Jill. And right now we're getting what we call a static scan. So she's standing on it, looking straight ahead, equally as she can. And if you look over here on the computer screen, you can see exactly the pressure points of her feet. Jill, go ahead and move your feet and your toes around a little bit. Okay, and if Corey looks up at the screen here, you can see it moving back and forth on there. So it's giving us a real-time measurement of how she stands. Okay, and what we're going to do next is take a picture of that when you feel like you're standing nice and equal. Do you feel equal, Jill?
Yeah.
Okay, and now Jill can step off, and what we do is we look at the static scan and we can see in quadrants where she's standing more on one side than another. So we can see if she was more on her toes or more on her heels, and we can also pull back and see if she's standing more on one side than another. Jill stands slightly more on the right side than the left side. And that can be significant for foot pain, for knee pain, for low back pain, especially if she's doing this over a long period of time, or if, like she is, Jill's a runner and very athletic. Okay. Questions on that at all?
No, so this red part is just where most of the pressure is. And okay.
Absolutely right. You can see where some toes put more pressure than others, and the heels you'll see more pressure, and then into the forefeet. Jill's scan looks pretty good, but we do see the difference on one side compared to the other. And next, we'll be doing a dynamic scan.
Right.
Okay. Alright, let me hit go here. Go ahead, Jill. Next, we have them walk across it. And you'll see that right away it gives us a dynamic view of exactly what's going on. And this was her left foot, so it'll slow down exactly how her foot was hitting the ground. It'll show us the areas of pressure, exactly how her rear foot, her midfoot, her toes are hitting the ground. This gives us a tremendous indication of how functional her foot is.
So is this showing like striking the heel first?
Yes, it is.
And then
Yep, so it'll start right here. Heel
Okay.
strikes first.
Okay.
It's going through what is about a second. It takes you about a second to go through that walking motion. And you'll see the pressure on your forefoot and
Okay.
off the toes.
Okay.
All right, and we're going to go ahead and do the other foot next. One second. Okay, go ahead. And now we have the other foot. And if we look very closely at these, we can see that she puts more pressure on the forefoot of her right foot, and that both feet don't exactly have equal striking in there. So what we can do with this now is we can, once we save it, we can go in and do a comparison to normal. So if we look at an optimal sample and compare, Jill's not too far off on that, but you can see the areas of increased pressure. We could also go back and compare, for instance, to somebody with really flat feet, what we call pes planus, and you can see the differences there. These can be printed and sent home with the patients. And then from this as well, we can pull up a 3D scan that shows the pressure points of the scan that we just took, again rolling from heel to toe. And from this we know that she spends 790 milliseconds on the left and 830 on the right, so she even walks a little longer on the right side than the left.
So what kind of implications would that have with the pressure points?
Well, over time, especially as we spend more years on our feet, things like bunions and heel spurs, plantar fasciitis in the feet, some of the worst foot problems we can catch early and correct before they become an issue at all. But certainly if we were to put some pressure and palpation and poke a little bit into these areas where we see these reds, you would probably be a little sore in those areas. Might be an area on your feet where you would get calluses or maybe corns eventually, and could turn into chronic problems, usually in your 40s or 50s. So by finding this and correcting this, we can help not only foot problems, but eventually low back problems as well, because the feet are the shock absorbers. Okay, so that's a normal gait scan that we do here at Pro Chiropractic. We actually have the first TOG gait scan in the whole state of Montana. As a new patient at Pro Chiropractic, you get a gait scan included in your new patient evaluation. No extra charge for that, just our normal exam fee. Thank you, Jill.
Thank you.